Welcome to the Crisis Response Podcast, a show about the regular folks who are tackling major problems and transforming how communities watch out for each other. I'm Jason Friesen, and on the show today, how Liz Ortenburger, CEO of SafeNest in Las Vegas, is pioneering the use of data, technology, and a highly motivated pool of crisis advocates to lower Las Vegas's homicide rate in domestic violence and sexual assault cases. Liz will also share how SafeNest is committed to treating the entire cycle of domestic and sexual violence through programs and services designed to prevent violence, protect victims, and empower survivors. Hello, Liz, and welcome to the show. Thank you so much for joining us. It's a real pleasure to have you.
Well, thanks for having me.
And we're talking with you today. You're in Las Vegas, correct?
Yes, I am.
So SafeNest Las Vegas, tell us, for the listeners who aren't familiar, what's your mission? What are you involved and focused on working on?
Yeah, so SafeNest is a domestic and sexual violence agency working on ending those two epidemics in Clark County, Nevada, which is the home to Las Vegas, but really within Nevada as a whole.
And how do you go about doing this? What are your services that you're delivering?
Yeah, great question. So we work in three distinct buckets: prevention, protection, and empowerment. In the prevention space, we work with kids that are at risk of repeating the cycles of violence that they've seen and witnessed and been part of in their homes, as well as youth in the larger community to raise awareness and understanding about what healthy relationships look like. And we also work with abusers. You know, most people don't talk about this side of our epidemic enough, but abusers have anywhere between, on average, 3 to 7 survivors in their lifetime. So while my protection arm, which I'll talk about in a minute, does a fantastic job of getting survivors safe, helping them heal and move out of those abusive relationships, what we don't want to be doing is creating a vacuum now for a new survivor to move into. So we work with abusers to end their cycle of violence as well. And then in our protection space, we have a lot of the traditional domestic sexual violence services, a hotline, a shelter. We work in the courts doing temporary protection orders and all those kinds of things. And where we intersect with Beacon in this amazing product is we also do metro response. So in Clark County, there's 100,000 domestic violence 911 calls every year. We work with Las Vegas Metro, which carries 70% of those. Of those 70,000 calls, 15 to 20,000 are going to result in an arrest. We are on those calls. The goal is to be on every call in person. We're on about half in person and half we have to do what we call safety net, which is meet the victim over the phone versus in person. And then we'll talk more about that program. But that program has really driven down our homicide rates in Clark County, Nevada, which is one of the most dangerous places in the country for women being murdered by men. And then finally, we work in our empowerment arm, which is really our long-term services. We work with undocumented survivors who are navigating the visa system. We do a lot of intensive counseling because what we don't want to do is just put a Band-Aid over the domestic violence portion of your abuse or sexual violence portion of your abuse. We want to talk about the polyvictimization most of our clients have experienced over a lifetime and the solutions and habits and beliefs and behaviors that abuse has created so that this pattern of being in abusive relationships doesn't continue for both our survivors as well as our abusers. And then we run a transitional housing program. Housing is the most requested resource for domestic violence survivors, and it's the most underfunded. So we run that program in partnership with other agencies and help get our survivors into safe, healing households.
That is a lot of intense, but I'm certain very gratifying work to be involved in. Our relationship, as you mentioned, is through the Beacon platform that we built. But, you know, as I remember it, when we first spoke, you called up, we were talking on the phone, and you were saying that you were working with a pen and paper system and you were growing and it wasn't working for you anymore. I'm wondering, how did that program even get started, right? Working with Las Vegas Metro, where did this program even begin?
Yeah, well, sadly, it began with a household of 5 getting murdered in a house that police had responded to several times before. And at the time, the captain in that area, Captain Larkin, who's now Vice Deputy Chief Larkin, she recognized that her officers were having a hard time. Her description is closing the loop, right? Officers do what officers are great at. They get the scene safe and they hopefully get the bad person, right? To use that language, incarcerated so that the family's safe. And they had done that at this household 2 or 3 times before. And the abuser, we have a 12-hour hold. The abuser was released. The abuser came back and murdered the entire family. So that is where Metro, Sasha in particular, Captain Larkin at the time said, enough is enough. We've got to figure out a pattern to work here. This coincided with me joining SafeNest, coming in as their CEO. She gave the project to Lieutenant Hatchett at the time, and he called me up and said, "Hey, I've got a wild idea. What would it look like for you guys to be on domestic violence 911 calls?" And me being fairly new to the field, I was like, well, that sounds great. So we started to dig in. I'm a data-driven leader. So we started to dig into the stats. And here's what we found that was incredibly daunting and at the same time, an absolute green light of why we have to move forward with this. Only 4% of survivors who are murdered will reach out to an agency like SafeNest in the 12 months before they're murdered, right? So that, like, only 4% are reaching out to these agencies who are designed to help and protect and stave off homicide. That's an issue. But the correlating stat is that 86% will have an interaction with law enforcement. And those stats come out of the Jeannie Geiger Violence Center. And so it made sense to us, right? We have to pair ourselves with law enforcement to be in the place where the survivors who are most at risk of homicide are. And so we started really small. We started in one jurisdiction. Our metro has 11 jurisdictions. We started in one. And essentially how it worked is officers responded to a scene. If there was an arrest or probable cause for an arrest, but the perpetrator had fled, we were then called out. The commitment that our police force made is that our commitment was we'll respond within 20 minutes. Their commitment was we will stay on scene for at least a half an hour while you're with the survivor. And at that time, when Metro leaves, we leave. And we've had Metro stay on scene for hours as we do this work. So we studied that and we said, okay, we've done it for a year in one jurisdiction. Let's look at the data. And what we found was they went from an average of 7 homicides annually to 1. And that 1 homicide, neither SafeNest nor Metro had any contact with. The other thing that we found was that repeat calls for service were just decreased by 90%. So wow. What was happening was survivors were reaching out to us now because they realized we were available. This created this window for that jurisdiction because their 911 calls decreased, that they could focus on the highly lethal perpetrators. So then we started to see more strangulation victims surfacing because the volume of calls was decreasing. And we could start to see that was creating this opportunity for Metro to get the most lethal perpetrators behind bars. So this was just absolute synergy in the making. I don't want to say it was not without a lot of hard work. I had a lot of pushback from my advocates that had been doing this work for a long time. We don't partner with police. We don't work with police. And the reasons we don't are because police they're not trauma informed. They're not doing all these things. There were a lot of barriers that we had to take down as an agency, and Metro dealt with the same sort of officers not wanting to wait on scene, officers not calling us, all kinds of things. So Tim and I, Lieutenant Hatchett and I, worked very closely together to ensure that he and I had a solid working relationship, because there were things we were doing that I had to fix. There were things his officers were doing that he had to fix. And the program just got stronger and stronger. And then right when COVID hit, so 2020, we got $500,000 to go Metro wide with the program, which the timing couldn't have been better. Right. Because now we're in every jurisdiction that Metro has. We're on 10,000 calls a year. And while our domestic violence calls during COVID jumped 20%, both from a 911 perspective, but also from a SafeNest hotline perspective, our homicides decreased. And that speaks to this gap, like what we've been able to do in that space. So that's why we started it. That's where it's gone. That was the magic that Beacon brought, because we were doing like, there's a big map on the wall. Okay, we had these little car magnets. Here goes a car to this pin. Here goes a car to this pin. And what the program, we use staff, but we also use a ton of volunteers. So what we were able to do was really bring in a volunteer workforce that could work from home, has the app, is able to log in, log out, clock in, clock out, say they're safe on a call, and all those kinds of things. And I can pull these wonderful reports, because all of the time, the pushback I get from the different jurisdictions is, it takes SafeNest forever to get here. And then here I come with my data. I'm like, oh, our average response time in your jurisdiction is 15 minutes. So you're welcome. So that's kind of the magic that Beacon really was able to provide, this much needed system. And I'll tell you, we work a lot with the 911 dispatchers. They're jealous, right? They're going, oh, it's so fluid, right? It's not a legacy system. So it's a lot more fluid. We can do things that they don't have the access to do. So yeah, that's the long-winded answer of why we started where we are, and the sort of magic that Beacon brought to the whole equation.
That's really awesome to hear, and it really, our staff, just, we really appreciate it, because it's such an impact that you're making, a clear impact, and it's really such a great thing to be working with you. There's a lot in there that I have questions about, and I'm sure other people will as well. So I'm going to try and backtrack a little. The first thing, and we hear this all the time with crisis response groups, especially in substance abuse, opioid overdoses, mental health, but particularly, excuse me, in your case, is, what about the risks to your advocates, your responders? Because everybody knows, well, most people know the statistic that for police, the most dangerous call is domestic violence. And so how do you address safety concerns, both, because I'm sure the police are like, well, you don't want to send your social workers to dangerous scenes, do you? And at the same time, your advocates are probably like, hey, we don't want to walk into something that's dangerous. How do you address these concerns on both sides?
Yeah. So the key, so first of all, the key is to get your staff, my staff and my volunteers, when they want to, on ride-alongs with police. So there has got to be an understanding of the different worlds that we both work in, and a shared desire. No officer that I have met is like, oh, domestic violence, who cares? That is a sort of, that's a myth that many, now some advocates have, I'm not saying there aren't officers with that mindset. But when the majority of officers that we work with have every desire to not go back to that household, for there to be options for this survivor, and for the family, and for the suffering to stop. And so know that we have a shared desire for that. And so what we work with is officers stay on the scene. And so there have been jurisdictions we have Las Vegas, Henderson, and North Las Vegas. North Las Vegas, I had a 15-minute meeting with the chief of police there, explained to her the program, explained that their commitment is they have to wait for us to get there, and then they have to give us at least 30 minutes to establish rapport. She's no problem. Signed the MOU. We're going to be up and running in that jurisdiction in January. But I have another police department. The chief isn't interested in implementing the program, because he isn't interested in having his officers stay on the scene, even with all the data, even with all the stats. What I would tell any partner agency, if they want to do this, the chief has got to be bought in. This cannot be driven by a well-meaning patrol officer or a detective. Unless the chief signs off on the MOU, you do not go live, because you don't have the buy-in. It's got to come from the top down. And that takes working. I mean, I have been to cocktail parties just so that I can talk to the chief, right? Just so that I can do the navigating politically that I need to do. But that is a reality of the program. Now, what we did, and I would recommend for everybody, is pilot, right? So pilot the program small and then get your data set and then get the chief's buy-in. The chief has to support the pilot though. Make sure whomever's running your police department is bought in. The other thing is my advocates had a ton of like safety concerns, right? If I'm pulling up to a house in my car and a neighbor is friends with the abuser and they see my license plate, this is all, there was a ton of stuff. And so we kind of did a Mythbusters and like we wrote down every sort of safety concern that my advocates had. And then we said, okay, realistically, does this make sense? And so, we couldn't like that was the big one was people were afraid they were going to be followed or they would somehow be identified. And that's never happened. So we did have though an incident where my advocate responded. She's sitting the intel we had was that the perpetrator had fled. She's sitting in the kitchen with the survivor, and the abuser came up out of the basement, and through the door. Now, this is why Metro stays on scene. Metro's on scene, right? So Metro's there. The situation scary, right? I don't want to downplay that. That's like your heart's racing. That's a very scary situation. Metro's right there. So they, arrested the guy and they took care of the scene immediately. Could that have been worse? Could he have pushed out of there with a gun? Absolutely. So that happened. We dissected it internally and said, okay, we need to make sure wherever we're meeting with a survivor, Metro has a direct line of sight if there's not an arrest made. So we adjust, right? We adjust. The other thing I would tell my advocates who were concerned is, look, we go to court all the time and sit across from the abuser with our client, right? We have never, and we've been doing that for 30 years. We've never had an issue. Like, have we been followed to our cars? Yes. Have we had things happen? Yes. But we've never had an issue beyond the setting of the court in which like someone's being stalked or information's being given. It doesn't mean that it can't happen, but if we've been doing it for 30 years and it's not happened, the likelihood of it happening is low. So we just talk through it, and it's a constant conversation. The team now, there's a whole team approach to it internally. They dissect this stuff constantly. And so it's about adjusting. What I told my advocates when we rolled out the program is this is happening. And those of you that want to be part of it, thank you. And those of you that don't can stay on the hotline. And that's okay. That's okay. Neither one is, I'm not going to shame you for not wanting to go out on the scene. But since then, we have had tons of volunteers come through the program and cycle through the program, and we have not had an issue. So I think a lot of the safety concerns they're inflated by what we're concerned about, but it's just, there are those like that one-off where he came out of the basement and we had to sort of reconfigure what we were doing and what that looked like. So yeah, so it's a conversation, and we don't go into it lightly. And that's why Metro stays on scene. And if Metro leaves, we leave. And so Metro secures the scene before we get there. That's a key. We're not in the car with Metro. We're not riding along with them and doing this work. They are calling us after the scene is secure. And that's important for folks to know.
Yeah. So that's actually my next question. What is, forgive me from a technology perspective here, but what is the user journey? Like, how does this actually play out, right?
Yeah.
Step by step, somebody, PD initiates the call to the hotline or 911 or both?
Yeah. Okay, so from the start, so a 911 domestic violence 911 call is placed through, or sexual violence placed through 911 dispatch. Officers are deployed to the scene. In our jurisdiction, 2 officers have to respond to every DV or SA, so domestic or sexual assault. Officers arrive. They do a very quick assessment as to whether or not it rises to the level of arrest or probable cause for an arrest, but the perpetrator has fled. As soon as they make that assessment, they're back to their 911 dispatch or radio, their 911 dispatch for SafeNest. Then the dispatch calls my hotline. I have 1 staff person per shift whose job it is to man the man our dispatch. They're in Empowered DB, in Beacon. They throw the address and all the information in Beacon. It gets broadcast out to whoever's active in that shift for those particular zip codes, because we're quite a large jurisdiction, so we have it broken down by zip codes. It goes live out to whoever's available. One advocate will hit 1 on their Beacon app or in the text. It shows they're responding. Then that sends a text out to all the other advocates who are alerted, like, hey, this one's been covered. And that person goes to the scene. When they get to scene, they indicate that they're there. I can't remember what number they press. They indicate that they're on scene, and then they go into their mode of being an advocate and working with the survivor. Then when they leave the scene, they hit another button that says, hey, call ended. And then they drive away and they're alerted about the next call. So all that information gets recorded. So sorry, one piece in there. Once they leave the scene, they actually let us know they've left the scene. Then they call the hotline and relay information, and hotline puts in all of the information into our new org database, our client database. That part is not as smooth as we'd like, right? Technology is like, it's a little bit all over the place, but that's okay. We're figuring all those out with different solutions, but it goes into our client database, because what happens is I then have hotline advocates who call back to that house 3 to 4 hours later, depending on if we did an emergency temporary protection order, whatever the follow-up requirement is, and we have different protocols. Or we'll deploy another advocate out to the hospital if the client was transported to the hospital. So that work continues. It just comes out of the mobile response Beacon program and goes into our client database.
Well, I don't want to make too many plugs here, but we will have to have another conversation, because in a month we're going to be releasing case reports so that you can
That might be a solution.
it may or may not be
Yeah.
useful to you, but like from the, especially the more medically oriented groups we work with, they're like, we need a patient care report, or they use different
Yeah.
terminology based on the type of group they are, but we'll talk about that.
Yeah. And
Um,
there's one other thing that we do that I really want those working in my field to hear. We get a verbal release from clients to say, can we share any of what we've experienced with you with the officers? And how was when we can, right? It doesn't always make sense to get feedback from a client, but it's like, can you tell me a little bit about the Metro response, right? So we're asking it in that context. Our clients say incredible things about the officers, like that they did these amazing things. I will tell you, as someone working in this field, officers do not hear enough gratitude. And so when we share our data in a quarterly report with our police. We macro data, we don't share micro data, but we include these comments. And when we get particularly compelling comments about an officer and we have that little release from a client, we give that to their captains. And let me tell you, that goes so far in how officers view our survivors. Our Metro police force is 90% male. This space is not as understood as it is for those of us that are in it every day. So when we can create this sort of wheel of gratitude, when they respond to a survivor the next time, it is a very, like, they're more entrenched in the work. The burnout gets better, all of these things. And so this is a relationship with your law enforcement agency, and it is we are constantly thanking them and sharing with them the work that they do, because like I said, they're on the front line. If an officer is killed, they are killed on a domestic violence call. They go on these calls more than any other call, and let me tell you, they get fried. She won't leave, she won't leave, she won't leave. And it's the more we can do to support and thank and bolster their work, the better it is for survivors. So that's the sort of the big piece of it.
that's very powerful. I mean, really, the positive feedback and the encouragement that in fact you are making a difference, and this
Yeah.
does change behaviors and attitudes and relationships. It's worth its weight in gold. I totally
Yeah.
understand that.
Let me tell you two sticky things that come up that agencies, I will tell you, don't let this be a reason not to try the program. So if there's a 911 response, we respond. So that means we don't have control over who we're responding to, and who those folks don't have control over us responding either. So there are known clients. So, for example, a board member or a staff member who has a 911 response to their household now is known to the agency as a client. We built a special code in our database for folks like a board member or a staff person, if they're known to us, that we can hide and mask that information. It still comes out in reports, but like there's a handful of us that know, because we want to make sure that internally we're protecting people um as well. So just that's just a very minute thing to think about, like there's no control over now, right? Like you don't maybe not ask for SafeNest. And then that same thing is with officer responses, right? So when officers perpetrate domestic violence, or like we have the raiders in town, if we respond to a public or a famous household, how do we manage that? So that's just an advertisement really for your PR team, your communications team, to recognize that the breadth of who you're working with shifts, because all of a sudden you don't have, no, the survivor does not have control over whether or not you respond. And that's just something to think through. Overwhelmingly, it's never an issue, but you have to just think about that.
With the
Um,
numbers, eventually, it's
yeah,
gonna happen, right?
right.
So that's a great point. Um, how do you so you have what type of staff do you have involved? Do you have your the folks manning the hotline, the dispatchers, call takers, and then the advocates? Is that basically the breakdown?
Yeah, so we went through a couple different iterations of how to staff this. When we first launched, we had we call it PS 417 because that's our code for a metro domestic violence call. So we had that staff separate from the hotline staff. So they were like even physically separate. They were in a different part of the office and they got dispatched from there. Let me tell you what that created was this like, we're your Top Gun crew over here, right? There was like a whole issue of like, we don't do anything but metro response calls. Like, okay, that's not working. So we actually integrated the PS 417 team and the hotline team. So when you're hired, you know what you're being hired for. But the mobile response crew is in the same room answering hotline calls if they're not needed out on a call, which that rarely happens because we're very busy. They're in the same room, they're the same team, they have the same leadership, and that has really streamlined what we were doing. Really, though, the idea is that we have enough volunteers that my all my staff that are going out on calls are backup. And so this is where if you have a university in your community, where can you find these folks? And so we have a whole criminal justice internship program, and those folks get trained and go out on calls. That's a little bit exhausting because they're only with us for 4 months, right? So we train you. By the time you shadow and you're out on call, you're able to answer calls independently, is like the last 2 weeks of your program. But it helps fill this need. And so volunteerism is the way this thing can grow. I have a couple of rural communities in our area that really want this program, and I'm like, look, I'll bring it to you, but it's got to be volunteer responders, because your volume's not enough for me to staff someone. Like you're gonna have 36 domestic violence calls in 6 months. It's not enough for me to put a staff person in your area, but we can train and get and support and have have your volunteers run the program. That's the only way to really sustain and grow the program in a way. We fund this, for those of us in this work, right? We fund this primarily through private funding and through Victims of Crime Act funding, so VOCA funding. But that's only going to get so big, right? And so really volunteers become a very important part, which is why Beacon is so great, because it doesn't care if you're staff or not staff, right? It's like you load the app on your phone and away you go once you're trained and ready. So that volunteerism piece has got to be, and we treat our volunteers very well, like we treat our staff very well, but they're basically unpaid staff. So they get welcomed in, trained in like new employees, and there's a cycle to that. But our volunteers are mandated to cover to remain active, to have 3 to 4 shifts a month. Our shifts are 6 hours, and that's the way that we have been growing the program. So that's the plug.
24/7, right?
24/7, 365. Yep.
So I mean, because I'm a paramedic, the training standardized, regulated, all sorts of groups, mental health groups have there's a lot of precedent for the training, but for what you're doing, I imagine there wasn't a textbook that you could pull off the shelf. What does your training consist of, and how did it come together?
Yeah. So great question. So there's a program in our community called TIPS, which is run through our fire department, which my understanding is that's a nationwide program. But what TIPS does is they send volunteers to the scenes where trauma has happened, not domestic violence type of trauma, but like if you had a house fire, right? If your uncle died in his bed and kids were there, right? Like you get a trauma informed volunteer to come to your home. So first I called on them, and they had a great training of how to deliver advocacy inside someone's home. So we adopted that, right? Because you are going into someone's home. I mean, occasionally, like there's times we're doing this work in hospitals, on street corners, all over the place, but most of the time, 60% of the time, we're in someone's home. It really talked about that. So we incorporated that in the training. And then all of the rest of the training really mirrors what we do on the hotline. It's just that you're in person, right? You're a crisis person that doesn't have a phone between you. And because we also run a 24-hour hotline, if you get into a situation on a call where you maybe don't know the answer, or you need to help a victim in a way that you don't know what the solutions are, you just call the hotline. The hotline is there to support our team that's in the field when they need it, which is pretty rare, actually. The biggest things that we do on scene is deliver information about domestic and sexual violence. We do a Dale assessment, so we help people understand if they're escalating to homicide, and we safety plan and talk about what that looks like. In our jurisdiction, if you're arrested for domestic violence, it's a 12-hour hold, which means if you want to get an emergency protection order, we need to be starting it now, because by the time we fill it out, get it faxed, because we're like old school here, over to the courts, a judge gets it on their mobile device and approves it. We're up against that 12-hour hold for the perpetrator. So we're doing all that work on scene. The other thing that we've recently added, and I would plug this for everybody, is we talk about strangulation and choking. That is the biggest red flag indicator that there's homicide is imminent. We know that not every strangulation is a homicide, but we know that every murderer is a strangler, right? So we talk about that purposefully with all of our on-scene response, because people need to know, and we need to make sure as advocates we aren't just saying, has he strangled you? We need to ask, was your airway ever blocked in any way? Because here's the thing that I think folks don't understand in strangulation is that 50% of the time there is no physical signs of strangulation. So that is why we talk about it, because if you've been strangled, what we want to next talk about is getting you a strangulation exam. Because at that point, I can do a no witness prosecution, which means a survivor can get safe without having to go through the horrendous court justice system gauntlet. We can prosecute that case without her or him needing to testify. So that strangulation piece is really critical for folks. And that's a plug for get trained, understand strangulation, and make sure you're talking about it in your communities. We also know that 80% of the time police are killed on domestic violence calls, it's a strangler. There's strangulation in that record. Yep. It's a massive red flag, and we're just sort of not seeing it as a community be talked about enough. So we're certainly raising the bar in Nevada. In fact, Colorado, California, and Washington states all just added legislation that strangulation exams are like SANE exams, no cost to the survivor, and they're provided. And we'll hopefully be following suit here in our next legislative session.
Wow. So you're throwing out a lot of very valuable and informative data, and it's so important to be able to prove that what you're doing is making an impact. So I'm wondering, aside from response times, which we say all the time, if you're a crisis response group, your number one metric is showing you can get there quickly, right? That
Yes.
you're going to be there reliably, consistently, and quickly. But and you said, I think you said less than 15 minutes, right? Which is
Our guarantee with Metro is 20 minutes. There are a couple jurisdictions where it's at 26. And as long as you know it, it's like you can work through it, right? But what I will share with everyone, every time I go into a captain's meeting at Metro, all the captains are like, oh, my guys are telling me it's 45 minutes, it's 120 minutes. And I'm like, here's the data. Here's every call we went on. So every once in a while, we'll have an outlier call because they need a bilingual advocate, or for some whatever reason we are all stretched, but the officer really wants an on-scene response. There are a myriad of reasons why it happens, but they're outliers. But every captain hears about the outlier. They don't hear about the 300 responses that were less than 10 minutes. They hear about, oh, we had one that was 130 minutes.
So that's interesting, because from an EMS perspective, usually the way the contracts are written with the city is that you have to get to 90% of calls within 10 minutes or 8 minutes, right? So it's usually like the 90% mark. So it sounds like you're well within the 90%.
Yeah,
Your
we
outlier.
are. And yeah, and the other thing I'll tell folks is our police force does not pay us a dime to do this. And I have worked with other agencies who want to spin up a program like this, and that's their first question is, what does your police force, pay you? Nothing. And the reason it's nothing is because I know how budgets work. I know how government budgets work. The minute we go into recession, there's a defunding or whatever, we're going to be the first things to go, because even though what we do is critical, it is that hoping that gets translated to financial people who are sitting in a dark room making horrible decisions about how to cut budgets is really far-fetched. We also want to make sure that it's not Metro's responsibility to fund this response. It's our community's responsibility. And so those are conversations that you have with your county, with your city, with the folks that have the funding pots to fund things like this. But primarily, VOCA is the main outlet for us. And private funding. So yeah, there's a relationship there with your police department, but I wouldn't make it a financial one.
Right. That's a great point. Probably one that a lot of people take for granted. What other metrics are you collecting to prove, to show your impact?
Yeah, great question. So homicide is the big one, right? So we have a relationship with our police force. We get their monthly data on how many calls they go on and how many arrests they make, and then how many murders there are. So we're tracking all related to domestic violence. So we're tracking all those right in line with Metro. So when I go and speak and somebody says, "Where's your data from?" I can very easily share with them that my data is from Metro, right? It's like, I am not making this up. My data is from Metro. So that's a big one, the homicide one. The other one that we track is how many restraining orders did we receive or not receive from those clients that went on scene, because that's also really critical for everybody to know, because that's when we start to intersect the justice system. So we're collecting all of this data to paint a picture. And really what we're doing is we're saying, thank you, law enforcement. This partnership is doing all these great things. We look at repeat calls to households, which is actually, that's the toughest metric to get, because it just doesn't roll off that easily. That's the one that takes some Excel masterminding. But here's all the second phase to that, right? Is we have all this great data now around this work with Metro and arrests and all these things. Our justice system does not track holistically convictions. So I have yet to be able to create the entire pipeline to sort of say from 911 call to arrest to arraignment to conviction, what are we looking at in that entire pipeline? So that body of work is next, because I'll tell you, one of the things that burns out officers immensely is not knowing, seeing these horrible things that they see in the field and then going, it's probably not going to end up in a conviction. And so, we're pushing all of the data bills in the next legislative session to say, how are we going to track this as a state, whom, by the way, on average is the seventh most dangerous place in the country for women being murdered by men? I think we probably need to have a better data set than we can't tell you. That's not right. So the data opens a doorway. Now, I will say any agency, like we're fortunate here at SafeNest. I have a business and data analyst background. If you don't have that skill set on staff, that is okay. Don't feel daunted by this. Figure out one or two things that you want to measure that are going to be critical and pick those. You don't need to be as elaborate with your data as we are. It's just I happen to love data, and we do some predictive analytics and things like that to understand the trends. That's because we've chosen to move to do that work as an agency. That is not a mandate. Homicide rate is the big one. And then response time is what your officers are going to really care about. The repeat calls to household, though, is a very powerful one. We back into the numbers, right? So we think every time Metro responds to a household, it's give or take $1,000, because it's two officers all the time. The 911, we kind of, we sort of can loosely say it's $1,000. If we can turn down the tap on that, right, and not have so many DV responses, it doesn't mean that Metro's budget goes down, but it means the cost of domestic violence in our community goes down. The other thing for everyone to know is Ohio, it's either Ohio State or University of Ohio. One of them did a fantastic research project on the cost of a homicide. The lifetime cost of a homicide is $17 million.
How
We have
how is that broken down?
Right. So within a metro, within a police force, there's a direct cost. Then you throw in all the court costs. Then you throw in the lifetime earnings losses and tax losses for the people who were murdered, right? They break it down in this report, which is, feels like such a huge number. We told our metro, look, this data exists, but let's just say the cost in our community of a homicide, without all of this sort of extemporaneous stuff they're putting in here, is $1 million. Cost of a homicide is $1 million. Can we all get there, right? Between the DA's time, the police time, court time, all of these things. And everybody was like, yeah, we feel like that makes sense to us. We can swallow that pill. Well, we've brought the homicide rate down in our metro area by 7, on average, 7 fewer homicides a year in the domestic violence space. And when we do the predictive analytics, it's larger because our homicide rate should have gone up. That's $7 million a year. That's not being spent on homicide investigation. So those financial numbers, if you have a CFO or a financial person on staff, give them the project of figuring out the cost of a police response. And there are some great online tools. That money talks. So when I go in and talk to county commissioners and folks, it's like, hey, what do you think domestic violence is costing our community? Right? What do you think? And they don't think about it like this because no one person writes a check. But when we start to break it down for them and saying, look, I'm not telling you that any of these dollars would go away if we bring down the rate. What I'm telling you is here's $30 million your community could deploy differently if you can partner with me on figuring out how to get homicide rates to go down. So those are the little tips and tricks on how to get working with folks. But don't get daunted in the data. Figure out what the key things are for your agency and start small, and then just build it. Just slowly build it. And once it gains momentum, do press releases, do PR, do the whole social media game. All of that matters, because I get the most traction from donors when I talk about the things that we are doing that are solution oriented. And for most donors, shelter's not a solution. Shelter's a Band-Aid because we've had something horrible happen. So these innovative approaches have really also elevated our fundraising differently.
That's really rich, a lot of rich information, and I'm very certain a lot of groups listening to this will be learning a lot. I mean, there's so much covered there. We have a corollary to your cost one. We talk about this in opioid overdoses, that the average cost, I read a study that the average cost of an ICU stay for an opioid overdose, whether they lived or died, was $95,000. And we have groups out there that are reversing opioid overdoses for about $1.50.
Right. Right.
And that's powerful. That's getting people to pay attention.
Yeah.
It's very fascinating.
Money talks, unfortunately, but it's true. And I think most folks, is government officials and donors and people, especially in the work that we do, they are used to this sort of like, and I'm not being pejorative to anybody, but this kind of like daunting sob story about all of these women are suffering in domestic violence. And that's not true. That is absolutely true. But we have to remember, the folks with the power and the money don't resonate with impoverished women in violence. There's a bias of that it's a choice. There's a bias of why doesn't she just leave? But when we can come to them with an innovative project and talk about dollars and data, we elevate in their mind the ability for there to be solutions that they should be connected to.
And I would even say they're trained to be very wary of the sob story, right?
Yes.
Don't get distracted by emotions. We need to talk about hard facts and numbers here. So there's this like almost like, oh, here comes they're trying to tug at my heartstrings. I got to put up an extra barrier.
Yeah.
That's absolutely true. What are your plans for the future for scaling? I mean, you mentioned
Yeah.
about rural areas and you've been expanding around Las Vegas, but this is something that sounds like it should be, frankly, a national program, right?
Yes,
Uh,
we were very fortunate that Senator Cortez Masto got reelected. Thank you, because that was a close race, because she's sponsoring a bill for there to be seed funding for this across the country. It has not worked its way through yet. I'm in contact with her office. We're hoping early next year. But that would allow Office of Violence Against Women to have grant funding available for this partnership. And we sort of worked with them to provide, here are the things that you need, like an MOU with the chief's signature, right? All those kinds of things to make this successful in different jurisdictions. And that should help spread it across the country. In addition, I'm working with University of Nevada, Reno to create an online training and booklet of all of our data so that anybody could pick this up and sort of say, okay, here's a manual on how to get this going. Because look, we've made enough, we have failed forward enough that I would love for other folks to not have to fail forward at quite the rate that we did. And we can share that information out to everybody on how to get a program like this going. And we have also done some presentations through the State Department to other countries. Malaysia and Kazakhstan have been the two big ones that are trying to figure out how to implement this program in their communities, which is vastly more complicated given the fact that like Kazakhstan has no domestic violence laws, but they get that it's an issue. And so how do we work outside of our legal system, but in partnership with law enforcement to get survivors safe and to work with abusers? So I think there's globally some great innovative things happening, and certainly nationally we've got some opportunities to expand this program.
this sounds like something that the World Health Organization or the United States High Commission, Human Rights Commission, a lot of the Red Cross, sounds like this is stuff that they would really like to adopt. I mean,
Yeah, and we call it the preferred provider network. We have a bunch of members here in Las Vegas. I think we're up to like 50 members who we've all trained how to do mobile response. And the reason we do that is because people are not always going to call 911 for a lot of reasons. They're also not always going to call SafeNest, which is totally fine with me. What I want to make sure is that any agency that comes into contact with someone who may be suffering from domestic violence understands the resources. And so what our preferred provider networks are able to do is they can do the Dale assessment and they can call our hotline, identify as a preferred provider network, and get that client into shelter with us without having to go through the full hotline intake. And then once they're in shelter with us, that preferred provider can continue to do advocacy inside SafeNest's confidential shelter location. Let me tell you, the group that has benefited the most from this right now is our transgender justice program, our transgender group, because transgendered folks are just not going to call my hotline, and that's totally fine. The same with our LGBTQ plus folks that come out of a different organization here that we work with. They're not going to call the hotline. They don't recognize that it's a service for them, even though we in no way discriminate. That community, and then churches. So deacons' wives and pastors' wives hear a ton of domestic violence because the church is safe, right? They, however, do not typically have the construct to continue to figure out what that is. So when we can work with, we have an interfaith council. When we work with that interfaith council and are able to coach and work with those, with the, typically it's the whomever, the wife of the preacher, for that's just the relationship that we see. And they can get help through the preacher's wife that's through an agency like SafeNest, and then the preacher's wife or whatever construct that church has to continue to support that survivors available. This is where we start to make sweeping change for survivors. And this is how we change that 4%, right? That 4% of women reach out. You got to open up your doors and say, I don't care a hill of beans if someone even knows that they're in my shelter. I care that they're safe. And we want to be permeable, still confidential, still incredibly safe, but recognize not everybody is going to see our hotline number or my logo and say, oh, that's how I get safe. How do you make sure everybody in your community who has impact knows how to get into your services, and you treat them with respect? You do not make that survivor call the hotline, tell their whole story again, and then 45 minutes in tell them you're full. That is not, and that is, unfortunately, that is kind of the going way that it's happening in a lot of communities. You figure out, and we use the Dale, you figure out what assessment you're going to use, train your community partners to use it, and then they know, look, I know that the domestic violence is daunting, but SafeNest isn't going to have a bed for you because the lethality score is not high enough, which I hate, right? I hate having to say that, but that's the reality. But then what are the other places that we can get you housed in a shorter time frame and get you safe, right? So this is how you work together to create that network of safety. And PS 417 has been such a launching pad for all of that with us on how do we get more permeable for everybody.
I mean, I'm just thinking about this, and it's like the name of the organization, SafeNest, really embodies everything you're doing, and that is so powerful.
Yes, I have to thank University of Nevada, Las Vegas, that did in the 90s the whole naming of SafeNest. They did a whole study, and we changed our name from Temporary Assistance to Domestic Crisis to SafeNest in the 90s because of great research from our university. And those university partnerships, if you're lucky enough to have a university in your area, they're so immensely helpful. I mean, they really care about what we're doing, and then the research they can pump out to elevate voice is really helpful.
So awesome. Really, I mean, just hats off to you and your entire team. Such impactful, meaningful work. Is there anything that I mean, you've already kind of listed them. I always like to ask, for groups that are trying to start out and follow in your footsteps, what would you recommend? You've already made a really bunch of good recommendations. Start small, that you've got to have your focus on what you're responding to. What else would you recommend?
Yeah, I would recommend buy plane tickets for Vegas, and we will open up. You can come and do ride-alongs with my staff. You can see the nitty-gritty. You can also hear, like, I'm the CEO, right? So everything's great. You can hear from my team that's actually on the ground that can share with you, hey, this is where we struggle. These are some of the things that work really well. This is something we need to improve. These are our systems. I don't think there's anything I can say or share that would be more beneficial than come here and see it in motion. and spend a couple days with us, and we're more than happy to host folks and share our systems and what we do. That is how I have learned a ton in my career, is just jump on a plane and go see what Family Justice Center in Tennessee is doing, for example, right? Like, just jump on a plane, come here, and we'll create a program and support your learning and answer any questions.
SafeNest.org. That's where they can
Yes.
find you.
Yes.
Excellent. Well, thank you so much, Liz. I really appreciate this. This has been awesome. And I know our listeners are going to learn a lot from it. And hopefully we can get it to a bunch of people who otherwise wouldn't be hearing about it. So thank you for
Awesome.
your time. Always a
Thanks,
pleasure.
Jason. I'll talk to you
Bye-bye.
later. Bye.